Well, as the government considers tightening regulations on healthcare workers returning from Africa, Congress is pressing medical officials on the U.S. response to Ebola. Julianna Goldman is in our Washington bureau with more on that. Julianna, good morning.
Good morning. With the new case in New York, the Obama administration hopes to soon have updated guidelines for healthcare workers who have come into contact with Ebola patients. An official says there are a lot of options on the table, but there was also some promising news yesterday with word that the first person to contract Ebola in the U.S. was cured of the disease.
I feel fortunate and blessed to be standing here today.
Straight from the National Institutes of Health to the Oval Office, Nina Pham got a big presidential hug. The nurse who caught Ebola after caring for Thomas Eric Duncan in Dallas was given the all clear and released from the hospital on Friday, one day after a doctor was diagnosed with the disease in New York City. In his weekly address, President Obama said the disease can be contained and defeated.
It's important to remember that of the 7 Americans treated so far for Ebola, the 5 who contracted it in West Africa, plus the 2 nurses from Dallas, all 7 have survived. Let me say that again. 7 Americans treated, all 7 survived.
But the symbolism of President Obama inviting a cured Ebola patient into his home and embracing her for the cameras did not soothe critics of the federal response. Lawmakers said the case of Dr. Craig Spencer, who returned last week from Guinea, exposes flaws in the system. Republican John Michael was one of several to grill health officials at a congressional hearing in Washington.
Anyone who has been exposed for 21 days coming into the United States must be quarantined. I don't care if it's inconvenience. They should recognize their own risk, too.
Democrat Stephen Lynch said officials aren't taking the threat seriously enough.
I don't think it helps to say we've got an aggressive thing on the ground, everything's good, because I got a feeling in a couple of months you're going to come back here and give us a whole different story.
Health officials at that hearing said failures are due to the fact that we're constantly learning new things about the disease, and also said that a large-scale outbreak in the U.S. is unlikely. The other nurse who cared for Duncan, Amber Vinson, is being treated at Emory University Hospital. She no longer tests positive for Ebola. The hospital has not said when she'll be released. Anthony?
Julianna Goldman in Washington. Thank you, Julianna.